Hi, a heart attack occurs when blood flow to the heart is severely reduced or blocked. The blockage is most often the result of a buildup of fats, cholesterol, and other substances in the arteries of the heart coronary arteries. These fatty deposits that contain cholesterol are called plaques. The process of plaque buildup is called atherosclerosis. Sometimes the plaque can rupture and form a clot that blocks blood flow. The lack of blood flow damages part or all of the heart muscle. A heart attack is also called a myocardial infarction. Immediate treatment of a heart attack is required to avoid death. Symptoms. Symptoms of a heart attack vary. Some people have mild symptoms. Others develop severe symptoms. Some people don't show any symptoms. Common heart attack symptoms include chest pain that feels like pressure, heaviness, tightness, squeezing, or aching. Pain or discomfort that radiates to the shoulder, arm, back, neck, jaw, or teeth, and sometimes to the upper abdomen. Cold sweat, exhaustion, heartburn or indigestion, sudden feeling dizzy or lightheaded, nausea, shortness of breath. Women may feel atypical symptoms such as mild or severe pain in the neck, arm, or back. Sometimes sudden cardiac arrest is the first symptom of a heart attack. Some heart attacks occur suddenly, but many people develop warning signs and symptoms hours, days, or weeks before a heart attack. Persistent chest pain or pressure angina that doesn't go away with rest may be an early warning sign. Angina is caused by a temporary decrease in blood flow to the heart. Causes of myocardial infarction or heart attack. Coronary artery disease causes most heart attacks. In coronary artery disease, there is a blockage in one or more of the heart's arteries' coronary artery. This is usually caused by deposits containing cholesterol, called plaques. Plaque can cause arteries to narrow, which reduces blood flow to the heart. If one of these plaques ruptures, it can cause a blood clot in the heart. A heart attack may occur due to a complete or partial blockage in one of the heart's arteries' coronary artery. There is one way to classify heart attacks. That is, whether the ECG indicates that there are certain changes ST elevation that require emergency treatment with an invasive medical procedure. Your doctor may use the results of an EKG to describe these types of heart attacks. Acute complete blockage of a medium or large artery in the heart usually means that you have an ST elevation myocardial infarction. Partial obstruction often means that you have a non-ST elevation myocardial infarction. However, some people with non-ST elevation myocardial infarction have complete blockage. Not all heart attacks are caused by blocked arteries. Other causes include coronary artery spasm. This condition occurs as a result of severe squeezing of an unobstructed blood vessel. Artery walls generally have cholesterol plaques or show signs of premature vascular sclerosis due to smoking or other risk factors. Other names for coronary artery spasms are Prinzmetal's angina, vasospastic angina, or irregular angina. Certain infections, COVID-19 and other viral infections, can damage the heart muscle. Spontaneous coronary artery dissection. This life-threatening condition results from a rupture of an artery in the heart. Risk factors. Risk factors for a heart attack include age. Men age 45 and older and women age 55 and older are more likely to have a heart attack than younger men and women. Tobacco use. This includes smoking and prolonged exposure to secondhand smoke. If you smoke, quit smoking. Hypertension. Over time, high blood pressure can damage the arteries leading to the heart. This is in addition to the fact that high blood pressure associated with other conditions, such as obesity, high cholesterol, and diabetes, increases this risk even more. High levels of cholesterol or triglycerides. A high level of LDL cholesterol or bad cholesterol is likely to narrow your arteries. A high level of certain blood fats called triglycerides also increases the risk of heart attack. The risk of a heart attack may be reduced if levels of high-density lipoprotein cholesterol, the good cholesterol, are in the standard range. Obesity. Obesity is associated with high blood pressure, diabetes, high levels of triglycerides and bad cholesterol, and low levels of good cholesterol. Diabetes. Blood sugar rises when the body does not produce or use a hormone called insulin properly. This increases the risk of a heart attack. Metabolic syndrome. It is a combination of at least 3 of the following: increased waist circumference, central obesity, high blood pressure, low level of good cholesterol, high level of triglycerides, and high blood sugar. Having metabolic syndrome doubles your risk of heart disease compared to not having it. Family history of heart attacks. If your brother, sister, parent, grandfather, or grandmother had an early heart attack at age 55 for boys and 65 for girls, you may be at increased risk. Not getting enough exercise. Lack of physical activity. A sedentary lifestyle is associated with an increased risk of heart attacks. Regular exercise improves heart health. Unhealthy diet. A diet high in sugars, animal fats, processed foods, trans fats, and salt increases the chances of a heart attack. So eat plenty of fruits, vegetables, fiber, and healthy oils. Stress. Emotional stress, such as intense anger, may increase your chances of having a heart attack. Illegal drug use. Cocaine and amphetamines are stimulants. They can cause a coronary artery to spasm, which can cause a heart attack. Previous history of preeclampsia. Eclampsia. This condition leads to high blood pressure during pregnancy. It increases the lifetime risk and the risk of heart disease. Having an autoimmune disease. Having conditions such as rheumatoid arthritis or lupus can increase your risk of a heart attack. Complications. The cause of a heart attack's complications is often damage to the heart muscle. Possible complications of a heart attack include arrhythmia or irregular heartbeat. Damage from a heart attack can affect the electrical signals traveling through the heart, causing changes in the heart's rhythm. Some of these changes can be serious, and others can be fatal. Cardiogenic shock. This rare condition occurs when the heart suddenly and unexpectedly fails to pump blood. Heart failure. Damage to adult heart muscle tissue may cause the heart to be unable to pump blood. Heart failure can be temporary or persistent chronic. Inflammation of the sinus-like tissue surrounding the heart, pericarditis. Sometimes a heart attack causes a wrong response from the immune system. This condition is called Dressler's syndrome, post-pericardiotomy syndrome, or post-cardiac injury syndrome. Cardiac arrest. In this case, the heart stops suddenly. Sudden cardiac arrest is caused by a sudden change in the heart's signals. Having a heart attack increases the risk of this life-threatening condition. It may also lead to death, sudden cardiac death, if not treated promptly.